Hi, everybody. This is Becky Pearson with Pearson Physical Therapy, and today we are joined with Dr. Greg Sextro from Central Nebraska Orthopedics. How are you today, Dr. Sextro?
Very well. How are you?
Great, great. So why don't we start out with introducing yourself. Tell us a little bit about where you came from, how you got interested in orthopedics, and just give us a little background on you.
So I'm originally from Grand Island, Nebraska. I grew up here, returned back to Grand Island about 18 years ago. I graduated from senior high in Grand Island, went on to school in Lincoln, Nebraska for college, and went on to the University of Nebraska Medical Center for medical school. And then did my residency at Mayo Clinic in Rochester, Minnesota after that. And then I've been back in Grand Island now for about 18 years.
Wonderful, wonderful. And so how did you decide that you wanted to get into orthopedics?
So I've been involved in healthcare most of my life. My dad was a podiatrist. I actually used to go up to Broken Bow years ago. So I've been kind of around the healthcare field and always enjoyed being in surgery. And so I played athletics in high school and got involved in some of those endeavors and spent some time in orthopedics. Liked what it involved. I tend to like to fix things. So orthopedics allows me to try and fix problems and get people back to their activities.
So are you a handyman around the house then?
I try to be. So yeah, growing up in Nebraska, I had all kinds of jobs. I worked on the farm, worked construction, worked at the golf course, and just enjoyed being outside and using my hands to do things.
Great, great. So yeah, you mentioned this, that you come up to Broken Bow, and we do really appreciate you coming up here. A lot of our elderly patients that don't like to travel, that it's nice that they can receive services right here so close to home. Tell us a little bit about some of the procedures that you offer here in Broken Bow.
So we order a pretty vast variety of procedures there. So we do, some simple outpatient surgery such as carpal tunnels and trigger fingers. We do knee arthroscopies there routinely. We can do shoulder arthroscopies there. I think it's been several years now. We started offering a total joint arthroplasty for knee replacements there. Presently, we're not doing hip replacements there just from an equipment standpoint. So I would say, there's a variety of things that we can provide services right there in Broken Bow. Yeah,
and that's when we spoke the other day on the phone, I didn't realize how many procedures you did offer here. So that's wonderful. And, it's that recovery afterwards, that trip home, if you have to go very far from home, that's kind of a miserable trip, I think, probably after you've had surgery. So it is, I think, comforting to know that you're able to do that here and also support our local hospital. So we do really appreciate you doing those. Let's talk a little bit more about your total hip replacements. So they're a little bit unique. You offer something a little different than most of the docs in this area. So tell us a little bit more about that.
So probably about 4 years ago, I got interested in what's called an anterior hip replacement, and felt that there's truly some advantages to that procedure. We can still use standard parts. We're not using any special parts to do the procedure. It's just a completely different approach to how we get into the hip joint, and feel that it's a much more soft tissue sparing approach to the hip. Which allows people, I think, to recover faster with less restrictions. And then in surgery, by using, we actually use fluoroscopy or x-ray within the procedure, and it allows us to fine tune everything we do. So after surgery, there is no surprises when you get an x-ray after surgery, because you're actually getting one in surgery. And if you're unhappy with how things look, or you can adjust it on the fly. And so there are no surprises afterwards.
That's wonderful. So you go in through the front of the hip, and so there aren't as many muscles to cut through. And so then that also helps so that there aren't as many precautions afterwards, correct?
Correct. I don't know if I can kind of show you on a model here. I don't know if you can, I don't know, it's hard to kind of see, but on a traditional hip replacement, the incision's more on the back side of the hip. We kind of split your kind of the gluteus maximus muscle to get into the hip joint. And then after you kind of split that, you're having to release some of the muscles on the back of the hip to actually get into the hip joint. On the anterior hip replacement, the incision's more towards the front of the hip. So there's an interval right here between what's called the rectus and your tensor fascia. In this little interval right here, we can open up this interval. By opening that interval, we can get into the front of the hip. And then again, there's an opening here without detaching the muscles where you can get into the front of the hip with really not detaching as many muscles to get into the hip joint to actually do the replacement.
That's wonderful. You know, working throughout the years with total hip replacements, that is probably some of the biggest things that I've seen with people. If they do have problems afterwards, it's that weakness in the gluteus muscles, and they end up getting a limp because those muscles never really got strong enough again afterwards, I'd say. So I think it is phenomenal that you can do that. The other thing that, you know, when you get a traditional total hip, anybody that's had it, they know that they've been told, you know, not to bend over to like tie their shoes, not to cross their knees. And I don't know that everybody understands why. And it's because in a traditional total hip, basically they cut through all those muscles and the joint capsule to get that hip to basically dislocate, right? To do the replacement. And
Correct.
So you have to avoid that in order to avoid redislocating that hip. But that is not the case with that anterior approach, correct?
Yeah, I think because we're preserving more muscle attachments, you have to dislocate the hip no matter how you get to the hip to do a hip replacement. But what you're really wanting to do is strive for stability. And the stability comes from first putting all the parts in correctly during the time of surgery to make sure everything's in a correct position. And again, we're using fluoroscopy and x-ray during surgery to be sure that occurs. And then by, I think, doing less soft tissue dissection around your hip, it provides better stability after surgery.
Yeah. Well, it's been really interesting for me to see. We've had a few of our patients that have went through that, and their recovery is so much quicker and so much less tissue trauma, like you said, and so it's been really neat for me to see that, and so I strongly encourage anybody to at least consult with you about it if there's a chance that they might need a total hip replacement. Tell me, who is everybody that needs a total hip replacement? Would anybody be a candidate, or anybody that would not be a candidate for it?
So I'd say right now I'm probably doing 90% of my hip replacements through the anterior incision. So the only people that I'm not doing them on are people that I would say are, you know, moderately or significantly obese. And the reason, because if you have that little bit of an abdominal fold on the front of your hip, we don't want to make an incision in that little abdominal crease, because I think that maybe increases your risk of some wound healing issues. And so we probably don't think it's worth the risk then to go at that point. But outside of those people with that abdominal fold, we're able to do most everybody through that approach. Yeah, there's not a specific age cutoff or anything like that. It's just the body habitus that decides it. Okay.
And you guys had to purchase special equipment to be able to do that, and that's why you aren't able to do that procedure in Broken Bow, right? That one has to be done in Grand Island.
Yeah, it's a little more technically demanding. We had to buy a special table. It's called a HANA table, where we place the patient on the table and your feet kind of go in some boots so we can move your hip around during surgery, and it allows us access to bring in the x-ray machine to get our pictures. And so presently, just from a volume standpoint, having all the equipment you need to do this is a little bit cost prohibitive. at the present time. We'll see what happens in the future. If you look at the history of what we've done here, like in Grand Island, when I first returned, I did what's called an anterior lateral approach, where initially you had to put people on some crutches for about 6 weeks to make them partial weight bearing to allow some of the muscles to heal. And then we transitioned and started doing a little mini posterior approach. But again, you're detaching some muscles. There's a little higher dislocation rate. And so we had to protect people for a while. And then again, about 4 years ago, we transitioned to the anterior approach. And again, with that, I let people full weight bear the day of surgery. And what I found with this approach is, if anything, you have to slow people down a little bit, because people feel too good too fast, and they try and do too much, and then sometimes they regress and get a little bit sore.
Any other things that you can think of that you you wish people did more of this that would help their overall health, or any common themes that you see with people that you think, I end up telling people this 10 times a day, and I wish that people would do, whatever it is to keep themselves healthier. Any nuggets for people?
Kind of several things. I mean, first of all, I guess, people have to be smart and be kind to their joints. We all think we're invincible when we're young, and, maybe do things we shouldn't do. So, having correct lifting techniques and be smart how you're lifting and carrying things. I kind of have that scenario of I tell people, cartilage in your knees, your hips, your shoulders are somewhat like tread on your tire. If you take care of them and be gentle to them, they last you a lot longer. So if you just be smart with your joints, they'll last longer and you won't need a replacement. The other thing is just, being healthy. Exercise is great. It preserves joints. It's good for your joint cartilage. And it helps stop people from becoming obese, which is the major stressor of joints. And I think anything people can do to exercise and control their weight and be healthy is the best thing for them.
Well, I sure appreciate you coming on here and sharing what you offer here in Broken Bow and giving us a little insight into that minimally invasive total hip replacement. And we enjoy working with your patients. And so thank you so much for taking time out of your busy day to do this.
I appreciate it. And you have a great staff in Broken Bow. You have a great OR crew there, and they provide a great service to your community. And I think it's a safe place to be. They do a really good job, and I would have no concerns about having any procedures done there.
Wonderful, wonderful. So if somebody wants to get a hold of you, can they just call your office? How do they get a hold of you?
So if they want to be seen in Broken Bow, they can just call the specialty clinic at the hospital, and they arrange my schedule and my appointments there, and they just do it directly through the clinic.
Great, great. All right, well, thanks, Dr. Sextro, and I think you said you had a busy day of surgery today, so we'll let you go so you don't keep holding anybody up.
We appreciate it. Thanks for having me.
All right, thank you.